I'm going to kick it off, give a little bit of context for this discussion today, which is really around California's policy development and how it can incentivize integrated care better for children, youth, and families. But I really am not going to have to do much. This is such a dynamic panel, and we've really set it up as a lot of discussion today across a couple of questions. And we were going to create some space at the very end to take one or two questions from you all. And if you may have noticed, if you were taking the survey either today or tomorrow, we've been asking questions, in particular about why or how we can be thinking about the policy development process in California in a different way and how it can really kind of promote integration. I've had a chance to look at some of those survey results, so I'm sure that you probably have questions for our panelists today. So I want to prime that pump as we get into the discussion. So a couple of aims for today. As I said, want to first kind of lay out some of the data that we have been collecting through a couple of different efforts, primarily through the ecosystem paper that you heard about yesterday. We're also going to have a chance to hear from some insiders, if you will, in Tanya, about some of the work that they've been doing to think about how to promote integration within the legislative process. And then obviously going to be engaging across a cut of the way that we think about policy development. And as you'll see, the kind of panelists that we have up here today are not all from, quote, Sacramento. We really wanted a vertical cut of the way that people are looking at this issue, and in particular to hear from some practitioners on the ground and how they see the work that's happening in Sacramento, but also to hear from folks that are both intimately involved in the policy process and intimately involved in helping to move policy in a really positive way for children, youth, and families. So one of the things that is that kind of started us off on this work through the process of doing some research on the Cal HHS ecosystem white paper is a lot of the interviews that we did with both national and California-based experts, asking them a whole range of questions around integration. Policy was not necessarily the central point of the research that we were doing, but it kept coming up over and over and over again. And interestingly, if you were to read the paper from cover to cover, you'll notice that there's a bit of an absence of discussion and dialogue and solution setting around the policymaking process. That data in particular was set to the side to focus on the 10 necessary components and thinking about how the work of implementation that happens across child serving agencies in California could really be, can be used productively. And so part of the effort that we kind of start today, and we'll be continuing on over the next year or so, is to actually look at that policy development process a little bit more closely. And so one of the things that we found as a part of the data that we've been kind of going back and revisiting from the ecosystem paper is across the interviews, they talked about the centrality of children, youth, and families, how it's important to make sure that their voice, the way that they see and experience services and supports are central to the way that policy is developed in California. One of the other things that came up quite a bit, and I love this quote, and I'm just going to read it verbatim because I think it's so incredibly powerful, is, quote, "We often tie the hands of those that we are asking to implement policy as a result of the conflict in our own policies and lack of any thoughtful, comprehensive implementation of consultation or technical assistance." As a practitioner for 10 years in systems, I can amen to that. Because so many times the way in which information, policy, or funding were coming down for K-12 education, it didn't have a lot of this, if any of it at all. Now, we've certainly made strides in a lot of those areas, but to see and hear this come back up again as recent as last year is something that makes you stand up and pay attention to where the system currently is. One of the other things that we found is this, continued siloing, and I think for a lot of folks in the room, this may not be a surprise, but that siloing contributes to a mindset of scarcity. Right? Because we sit within the places that we sit, we believe that the resources that we have, particularly when somebody says you can't have more, or you have to fight tooth and nail for that next dollar, that there literally is no more. And the reality is that that's just not true. That there are resources that are out there. Arguably, we probably absolutely need more as one system, but we are not taking advantage of that opportunity because those silos create the inability for us to look to the left and right to understand how we can complement the work that others are doing. And that came up as a consistent theme in the interviews that we were doing as well. Interestingly, this other theme was coming up around micro-integration. It was referenced and cited a couple of times. There's not a lot of it out in the literature, but as you read the kind of narrative and the transcripts around the interviews, what was coming up was largely that those individuals that really want to make this a part of their professional life, a part of the work that their teams are doing, that they are doing this within their own huddle, but it's almost like think about it as like a nesting doll, right? That if you don't have the support and the vision of those that are higher up in your institution, the efforts that you're building may actually create more redundancy in your efforts to do integration versus getting the entire system to move in that direction. Hence, coming back to this conversation about how policy, as a way to set the frame for the work we do in the state of California, can help to drive this work. So all of these insights came out of this work that we did with the ecosystem paper, and we have continued on this path to do a little bit more work to begin understanding, well, what is it fundamentally that's happening within California state policy? Is there a way to capture some of these results in a more quantitative manner? And to set the stage for this panel, one of the fundamental ways or methods that we use in kind of assessing initially some of the California policy, particularly that's been passed in the last 3 years for children, youth, and families, is Weaver's collaboration spectrum. If anybody's familiar with this, Weaver's theory about this basically promotes the idea that individuals and or teams or systems are basically and can be plotted on this spectrum anywhere from competition all the way to integration. And she identifies different ways or things that you can look for in order to know and understand where you are within that spectrum. So as one initial step, we took to analyze a set of California policies. There were about 12 in total over the last 3 years that probably total somewhere in the ballpark of $30 to $40 billion that are being moved into the children, youth, and family system in California. We used this theory and the terminology and the language and the phrasing associated with it to look for it in policy, right? As one way to understand what is California policy communicating, at least on paper, when it comes to thinking about issues of integration. So a couple of highlights here, and then I'm going to turn to our panelists to do some introductions. The first good news is the word competition didn't come up, so that's good. The other good piece of news is that we were seeing a lot of these terms that were coming up, but they often were kind of in the middle of the spectrum. Things like communication or coordination or cooperation, but not so much on the collaboration or integration side, right? So if you think about an X by Y plot, if you were to kind of plot the frequency of these terms in this legislation, regulation, funding applications, you would see kind of a belly of frequency that would pop up in the middle of this spectrum and then kind of die off as you move to the right. A couple of other really interesting findings that came up as a result of this as well is that when integration did appear, it was not and often tucked away in language, like when you look at the text that surrounds the terminology in the context of training or providing technical assistance. So it would say something like, technical assistance or training shall be provided to X agencies, and among the 10 things that you could provide is training around integration. It was like number 9 on the list, right? So it showed up, but the context becomes really important to understand that it was in the context of providing training and support to professionals in the field rather than something that framed the way in which we were operating in our systems on a day-to-day basis. So a couple of other really interesting things that have showed up so far. First, and I think that this is probably, again, not a surprise to some of you in the room, that it was permissive but not prioritized, right? So you're allowed to do integration, you're allowed to do collaboration, but it was not necessarily prioritized. The analogy that I like to use with this as I was thinking about this early result is when I would come back from swim practice on Sunday afternoon, my mom would come up and she would say, you can go hang out with your friends at 5 o'clock, remind you that dinner was at 6, but before you do that, you have to do this list of chores. And if you tallied up all the time that it took to do that list of chores, it took me all the way to 6 o'clock. I was allowed to do it, but I had to do all these other things first before I could get to going out and hanging out with my friends. One of the other things that came up is that the other references to integration were often overshadowed by those priority items. And in particular, the point that I would draw out here is that it was clear to see that often those other prioritized items often would be in conflict to integration. So if I'm spending my time working on administrative work or submitting a report to the state, it was often as a way to kind of push me further into my silo, right? Think about that. If that's the way that policy is being written, if there's other ways in which you're framing out, I don't know, say job descriptions for professionals that work in the field, I'm framed around those rules, right? Couple of other things, little to no evidence around cross-listing of other policies. So you may say, well, Jason, if one of these policies was written in 2018, how could you possibly expect that another policy that was written in 2022 would make that reference to a prior piece of policy? So we wanted to make sure that when we were doing this analysis that we were kind of capturing a window, and I think it's important to emphasize this was just a single window of time that we were looking at, but there was an opportunity for those policies to be at least cross-listed. So if I was writing out the law for community schools and the one that was being worked on for the Children, Youth, and Behavioral Health Initiative was happening at the same time, there may have been an opportunity for that to happen. We don't know if that's true or not, but we don't see any evidence of that, right? So there's, again, that's kind of, when you talk about community schools, it's all about community schools. When you talk about expanded learning, it's all about expanded learning, so on and so forth, right? So I want to kind of lay that out as an opportunity to just say this is early returns from some of this analysis, and I think really kind of set the stage for our panel this morning. And so what I want to do is turn to each of our panelists. They're going to introduce themselves, talk a little bit about their relationship to this work. And I think for our first one, Tanya, I'm going to be operating your slides, yeah? Okay. All right. You're up.
Good morning. I'm Tanya Lieberman. I'm Chief Consultant to the Education Committee of the State Assembly. And one thing you should know about legislative staff, we don't speak on microphones. We write talking points for other people to speak on microphones, so this is an unusual situation for me. And if you ever see us on mic in a hearing, it means that something has gone really wrong. We also don't use PowerPoint, just so you know. That's another thing we don't do. So two unusual experiences for me this morning. I'm delighted to be, I love breaking barriers. This is such a special gathering. It is so powerful what's happening in this room. I'm going to talk a bit about kind of my journey to understanding the role of policy in integrating services and help for kids, and also share with you some kind of messy artifacts from some of the work that we have done in this area. So I want to start by just asking, raise your hand if you have come to Sacramento on a lobby day to lobby the legislature with your professional association. Great. Raise your hand if you have sent in a letter, email, made a phone call in support or in opposition to a bill that was in the legislature. Oh yeah, here we go, good. Any of you testify at a hearing on a bill? Oh wow, yeah, there we go. And how many of you have implemented a law or received state funding appropriated by the legislature to run a program? All of us, right? Okay, so we're all connected to our policy process in some way. People often don't understand, what we do and our role in the process. So I'm just gonna give you my best analogy, borrowed from an old-time staffer, which is that the legislative process is sort of like a parade. It's a really long parade. It goes from January to September every year. There are about 1,500 entrants in this parade walking along the parade route. They're each ideas. And at some point of those 1,500 ideas, the ones that have to do with education peel off and they come to the education judging booth, which is our committee, composed of members, elected members of the legislature. And our job is to take a look at all those ideas that come to our committee. And for a small number of them, we say, you look great, you're just perfect, you're a great idea, you can move on to the next committee, to the fiscal committee. For most of them, we say, you know, I can see what you're going for. I can see what you're trying to do here, but your shirt's on backwards and your shoes are untied and you have a lot of lint and you need some work, so we're gonna amend you to look better before you move on to the next step. And some ideas we say, you know, you just got to reevaluate this whole outfit. This is not working for you. It's not working for me. And you just go home and think about it and come back next year. Or don't. Maybe just don't come back next year. So that's sort of what we do. We evaluate ideas that are introduced by members of the legislature, and that's our role. Next slide, please. Thank you. So like I said, I love breaking barriers. I think I've been coming for about 5 or 6 years. And my favorite part is actually sitting at your table. So I'm the random person who sometimes like sits down at your table and says, do you mind if I listen to you? Because I love listening to you figure out how to work together to serve kids. It's just incredibly powerful. So the truth is, I don't really understand what you're talking about when you do that, right? I'm monolingual, I speak education, I don't speak health, I don't speak human services or public safety, but I'm really drawn to the power of those conversations that you're having. So a few years back, sometime before COVID, I can't really remember, I was at Breaking Barriers, and I was sort of half listening because, again, I don't really understand what you're talking about, but my ears prick up whenever I hear references to legislation, because that's my job. So I kept on hearing AB, you know, we get funding through AB this. Well, SB this requires us to do this. Well, AB such and such says that we can't do it this way. And suddenly this light bulb went off in my head. And I thought, I have to find Elizabeth. I have to tell her something. Is this a true story? This is a true story. So I looked around the room and I was like, I have to find Elizabeth. And I chased her around the room and I found her right about there. And I said, Elizabeth, we're the problem. I finally get it. Our process is the problem. And she looked at me like, who are you again? What I got in that moment was the reason why it's one of the challenges, one of the reasons why it's so difficult to serve kids, to integrate care, to serve kids well at the local level, is that our policy making is completely siloed at the state level, right? So we don't have a tradition, we don't have a practice, we don't have a culture, we don't have a mindset around working together to develop policy to make it makes sense. So we come, you know, education policy comes down the education chute to you, and healthcare policy comes down the healthcare policy chute, and we have not been able to work together to put it together before it gets to you. So that was the big revelation that I had. So here's what we did after that point. So I'd been, you know, pulling my colleagues along. Some of them are here. I'm so happy they're here. From the State Assembly, representing healthcare, you know, human services, housing, other issues, and so this is us. I asked for our own table. We sat at that table right there, and we tried to mirror what you're doing. We tried to talk to each other about working and try to figure out how to work together. So this is a couple images from one of those, I think from that year prior to COVID, and that piece of chart paper is us trying to map some of the policy connections in between our different areas, and that's been on the door of my office ever since. Next slide. Thank you. All right, so I'm going to skip over this just to say, like, just mapping some of the connections is really powerful. And also I heard a lot of talk yesterday and today about relationships. That was actually missing too. We didn't really know each other. And so one of the first steps was just to get to know each other. Next slide, please. So I think you can, hopefully that'll show up. Okay, yeah, you can just put those all up. So these are all going to look really familiar to you. Basically, we have the same problems that you do. You guys have, like, you experience like protection of territory, different priorities, misaligned incentives. Well, if I work with you, we're going to save money, but it's your system that saves money, not mine. That happens to us too. Not enough. Are you guys familiar with this not enough time problem? There's not enough time. And for us, it's the moment when we most need to be working together, when all the bills are in committee and the budget is in full swing. That is the time when we have the least time to work together. It's very backwards. And the one thing I forgot to put up here was it's nobody's job. You guys experience that too. Integration is nobody's job. Thank you. Next slide. All right, so this is just a few artifacts from us brainstorming, like how would we do this? How would we start to try to work together? Next slide. I put that all together in just sort of a graphic to show, like, here are some of the steps we could do to start building a culture and practice of collaboration in policymaking in the State Assembly. One of those things was just, started with trust and relationships. So one of the key pieces was just developing the most basic understanding of each other's systems. I really don't want to understand health policy, but I really want to know, what I want to know is the bare minimum that I can know, like what's the governance structure, where does the money come from, what are the big policy trends, and then I want to know Lisa, because Lisa is the health staffer and she will help me and we'll figure it out together. Next slide. Those are just some brainstorming about how we could go about doing this. Next slide. So one of the things we did is, like I said, we just trying to develop just basic understanding of each other's systems. We did speed cross briefings. So we got all of us together. I asked everyone to answer these 5 or 6 basic questions, and then we just speed briefed each other. And I learned a whole lot about the other systems. Next slide. So this was an incredibly powerful exercise. So I asked Daniel Stein from Stewards of Change to lead us through, to bring us a case study of a fictional family. This is the Thompson family. They are involved, the kids and the parents are involved in multiple systems. And we all got together, health, judiciary, education, human services, privacy. We all got together and we learned about this fictional family together. And it was really powerful because we only see our slice, right? When we're doing our work, we're all trying to do good policy through our own system, but we don't get to see what it looks like for one family. And it's awful. It's an incredible mess. So we had different reactions to this. So some people said, well, we've been trying to deal with this by, co-locating services at a place. So community schools, that's our strategy. And the people from judiciary said, well, actually, we're trying to co-locate all of our services at the courts, which I didn't know. Other people said, what we're trying to do is fund navigators to help people navigate through the different systems to get what they're entitled to. And some people said, oh my God, this is such a mess. We just need to do universal basic income. This is too much, right? And some people, meaning me, said, actually, maybe we should try to work on integrating our policy, try to clean up this mess, and going forward, integrate policy before it even gets to the implementation stage. Next slide. Thank you. So we also sometimes we do joint site visits. Those are wonderful. I love doing site visits. The trick there is that unless we have really good facilitation, I just see things as education, and Lisa sees things as health, and we never get to sort of integrate and understand each other's systems any better. So that's a bit of a challenge, but it's a great opportunity. Next slide. I'm going to skip over this. These are just my personal thoughts about how we might be able to move forward with this agenda, but I think it's going to come up elsewhere. So just to close, to say I'm so inspired by the work that you do here. It's really, it's world-changing. So just a quick story. A few years ago, I was working on a state audit around school districts' identification of students as homeless through the McKinney-Vento program, and I threw in a question at the end that said, after you tell us all the bad news, can you just give us a bright spot? Identify a district, please, that is doing a really good job identifying kids, and they did. And I looked at this district's dashboard, and their outcomes were outstanding, like 30 points higher than the state average. It was really remarkable. And so I called them and I said, so, could I come down just and learn a little bit more about what you guys are doing? And they said, sure. And so I flew down, and they brought me into this room, and they said, here's our secret. This is our secret. This is education, the mayor's office, the health clinic, the transit system, probation, housing. This is our secret. This is how we do it. So this is my inspiration. What you do here is my inspiration, and I look forward to the rest of the discussion.
Awesome. Thanks, Tanya.
Thank you.
Yep. So we're gonna turn to Natasha next. The thing I'll say, because Tanya, just to be really clear, so she's the chief ed consultant for Assembly. All those 1,500 bills goes through either her or her staff. So she is at the helm of this work and kind of speaks truth in the authenticity of what she's been seeing with education and some of our other systems. So thanks for joining us, Tanya. Natasha, I'm going to turn to you.
Thank you. Hi, I'm Natasha Hall-Sevilla. I am the executive director of the primary school. We have two locations. One is in East Palo Alto, and I lead our location in East Palo Alto, and I lead our site in San Leandro. We are deeply rooted in partnership and in integration. One of the things that we definitely believe in is partnering with our families, starting early with children, and then again integrating services. So one of the ways we start early is to make sure that our youngest children, 0 to 3 years old, receive assessments, child assessments, and then referrals and resources. We do that in partnership with Kaiser Permanente. We have Kaiser staff that are on site on campus. They provide supports for our children and families through that assessment process. We send referrals through Kaiser so that there's more of a seamless process for them. We also partner with our families. Parent Voice is hugely integral in our program. We believe in the power of our parents to do incredible things, and we believe that they truly are their child's first teacher, and we continue to remind them of that. We continue to remind ourselves of that. We include Parent Voice in our co-design. When we invite parents to join our design sessions, we do so with the intention that we're going to do something with their input, that we're not just inviting parents to say things that we're not going to do anything about or not do anything with. We include them in iterative processes. So we don't design programs to say that this is the way it's going to be, but we make sure that we continually go back to families and say, is this working for you? Is it something that you feel like you need? Is this something that brings value to you? Because if families are telling us that it's something that doesn't bring value to them, then we need to stop doing it. Otherwise, we're just providing things that people are not asking for, and I think we do a lot of that, and I think it's really time to stop. If I'm completely candid. I mentioned we integrate services. So again, we're partnered with Kaiser Permanente. They do have 2 staff members on site. We have an RN and a medical assistant. One of the other things that they do is we have integrated meetings with Kaiser staff. And so if there's a concern that's raised in a classroom, we bring it to our health team meeting. We talk about what might be the best course of action for a child. We bring in families into that conversation, and then the Kaiser Permanente staff might schedule appointments with the family right there on site, or they might give medical advice to the family so that barriers are taken out of the relationship between education, family, and the healthcare system. It's really reducing replication of services or duplication of services to families. We also partner with Tiburcio Vasquez, which is a dental health provider in the East Bay. They actually come to our school. They set up a dental chair. They do x-rays. They do cleanings right on campus. The Kaiser Permanente staff goes into each one of our classrooms, and they start doing activities with the kids about dental health and proper dental care. They do an activity, and I always like to talk about it, but they take an ice tray and they put shaving cream on it and have the kids brush the ice tray so that they can show proper toothbrushing techniques and use yarn to go between the ice tray so that kids are able to get excited and know how do I brush my teeth. So when Tiburcio Vasquez comes and they sets up the dental chair on site, kids are like, when is it my turn to get in the chair? And so it's just so amazing to watch kids like build this love of health, build this love of well-being right from the classroom. And one other thing I wanted to mention too is that one of the things that we like to start our meetings with is called a strong start. And so an example of a strong start might be if I asked all of you to turn to one another and name one word that you're feeling today. Some of us might say we're excited. Some might say we're exhausted, we're tired, we're overwhelmed. And so at the primary school, we say that all of your feelings are welcome, all of your emotions are welcome. And we invite families to bring all parts of them to school, because if we are able to show up as our true selves, then we can actually really make change happen. That if we continue to show up as what we're expected to show up as, then we're going to keep promoting things that are just unhelpful. And so we continue that message to our visitors, to ourselves. We invite ourselves to do that too, to welcome our own emotions, the things that we're also going through. And then lastly, I want to share an example of what this integration looks like on campus. So do I have enough time? Sorry, okay. No?
You didn't ask, keep going.
Okay, all right, I didn't ask. So I want to share an example about what this integration really looks like. In one of our classrooms, we had a child that was eating chalk on the playground. And so one of the teachers said, hey, they're eating a lot of chalk. And so, I used to eat paste, but I don't know if anybody remembers that paste that smelled like peppermint. And so, okay, it was really good. So I always got in trouble for that. And so we had a child that was eating chalk. And so we brought that concern to our health team integration meeting. And doctor said, you know what? That might sound like pica, and I had never heard of pica. The teachers hadn't heard of pica. And so one of the Kaiser nurses said, you know what, let's talk to the parent and see if we can schedule an appointment with them. So they got right on their computer and scheduled an appointment for a family to meet with their pediatrician. When we talked to the parent said, I don't know, I'm really worried about having my child assessed. And so parents also are assigned a parent wellness coach and do parent wellness group coaching. So when families come in, they're assigned that parent wellness coach, and the whole purpose of that parent wellness coach is to build safe, trusting relationships with that family, so that when things like this come up, they're talking with someone that they can trust. They're talking to someone that knows that they have their best interest at hand and their child's best interest at hand. So when we have to have conversations with families about, I know you're really concerned, but this is something that's really important to have your child assessed, but we're gonna go at your own pace. We're gonna go at your pace. If you're not ready for that, we're not gonna push that. But we are gonna talk about what are barriers that are coming up for you that are creating this, this worry or fear about having your child assessed. And we talk about that. Sometimes it's cultural. Sometimes it's steeped in worry and fear about how their child's gonna be labeled or what people are going to force them to do based on this information. And so the parent wellness coach is able to talk with that family, help support them through the barriers that are coming up for themselves. And then the parent is able to move forward and get and was able to get that child assessed. The child was diagnosed with low iron, was provided iron medication. And then we realized there was another barrier. So the parent wasn't picking up the medication. And so we had to okay, parent wellness coach, let's talk with the parent and figure out what's going on. So we found out that the parent was having issues with transportation. She was working for Amazon and her hours were middle of the night. And so when she was awake during the day, she was sleeping. And then she didn't have transportation to go get it. So all of these things that were coming up that were creating barriers for her to really access the supports that she was receiving. And so parent wellness coach talks to the parent again and talks about, let's talk about support systems. Let's talk about other people that might be in your life that might be able to support. So she was able to identify someone that could support her to go pick up the medication. So now child is on medication. And then now that the child is on medication, the teachers are then able to report that, this child is doing much better in the classroom. They're able to attend better because is exhausted because now we know that that child was suffering from iron deficiencies. So, so it's just been a beautiful, beautiful thing to watch, to see how integration actually happens on the ground. And I'm really grateful for spaces like this to talk about how can we do this kind of integration, but more globally. One of the wishes and hopes that we have, or our big bets, is to really be able to expand this type of work, not to just do this in a silo or do this on our own in a small school, but really, really learn from this and to expand this to other communities, to other schools, to other types of school systems. So thank you so much for allowing me to share.
Awesome. Thanks, Natasha. Trina? Go ahead.
Good morning, everyone. My name is Trina Frazier, and I'm the Assistant Superintendent for Fresno County Superintendent of Schools in their Student Services Department. And our journey began in 2005. I was assigned a mentor, Ron Powell from Desert Mountain, and he said, Trina, come to Desert Mountain and see what we're doing to serve our students with mental health services. And so I did. And I spent the day there, and I was just so impressed with what they were doing for the youth. And so I came back all gung-ho to Fresno County, and I asked to meet with our Fresno County Department of Behavioral Health, and we started meeting, and we met over the course of a year. And we just could not come to an agreement to start something similar. There's risk involved, and it's a lot of unknown things out there that surround providing mental health services in schools. And so we, the dream never went away, and so it just kind of lay there in the back of our heads and in our brains. And so Senator Bell, I think it was 2016, was carrying a bill that proposed that LEAs and counties work together. And I had a state meeting, and so I sent a colleague, and we came up with bullet points to the hearing and got up to speak. Well, back home, I didn't know this, but we had a new director at the Department of Behavioral Health, and she's watching this live testimony. And she runs in the other room and to her deputy, and she says, do you know who this person is from Fresno County Superintendent of Schools? They're saying that we're not collaborating. And she goes, oh, yes, I've known her for many years. And so they immediately asked to meet with us. And so we said, sure, we'll meet. Like, we met that week. And they came into the meeting. They were not happy. I'll just tell you that. They were not very happy with us. And so we explained and shared our story about how we had been trying to develop this partnership and work together and create this integrated system of care. And so we met for about an hour, and we left the meeting, and we said, let's form this partnership. So we did. And that was 2016. We planned for 2 years. We wanted to create an integrated system of care where all students would have access to mental health services in every school in Fresno County. And we went live in July of 2018. They gave us a 6-month ramp-up period to put everything in place, create job descriptions, hire the staff, do all of those sorts of things. They allowed us to build into their Medi-Cal billing system. It was, at the time, it's called Avatar. So all of our clinicians and case managers build into that system. And they had a productivity rate that they had to meet of 60%, meaning of their day that they spent their 8-hour day, 60% of their services had to be billable to Medi-Cal. And we called it All for Youth. And we called it All for Youth because we wanted to make sure all youth had access to those services. And we started out that way. So we were able to serve private insurance through short-term care through the prevention and early intervention dollars, because 20% of our agreement was prevention and early intervention. And then COVID hit. And when the students returned to school, our referrals doubled. And so we were, we had to scale down, and we said, the Department of Behavioral Health said, you can only serve Medi-Cal eligible kids. So it was really hard for us, because you have a classroom, you have 2 students who have the same needs. One has private insurance, one has Medi-Cal, one gets services and the other doesn't. And those families could not afford their deductibles. They could not afford their copays. They could not afford to get to Fresno to get the services they need. So even though we were trying to link them to these services, they could not access those services. And then, we have so much in Fresno. We're in 373 schools with clinicians and case managers. We have 167 staff in this program, but yet we still have so far to go. There are so many barriers and so many gaps, and it's all of those things that all of you talked about yesterday. We experience the same gaps and the same struggles. And then there's Medi-Cal reform. And July 1st, we moved from being a cost reimbursement agreement to a fee-for-service model. And our county happened to be one of the counties that came in at a very low rate. So we had neighboring counties that had a much higher rate, even though their demographics were very, very similar. Our demographics were the same, pretty much, very similar, identical in some cases. Our rate was very, very low. And so it has been a struggle. Like our first month, July, we were 1.4 million in the red. And so we knew that we had to get our productivity up to get to a place where we could start to backfill the other months, because July is a slow month. And our services don't stop in the summer because the mental health needs don't go away in the summer. It's year-round service. So July is a slow month for us. December is a slow month for us. We have Thanksgiving break in November. So we knew that those other months, we had to make enough to backfill for the months. And we're finally in the black. So we're really excited about that. But just so much that needs to still be done. Belinda's here. SB HIP, we've looked at those other funding sources and how they can fill in our gaps and barriers, because there still are so many. And so, like, for example, with SB HIP, we're installing wellness centers and looking at mobile units. And so where can we fill in with that additional funding, CYBHI, how can we fill in, apply for those rounds of funding and fill in those gaps that we experience? We're looking at the fee schedule now with managed care plans. So even though we have so much, we have so far to go.
Awesome. Thanks, Trina. Okay. Last but not least, and she asked to go last, Lishaun. All right, but you stand between us and questions.
I feel rushed now, Jason.
Don't feel rushed. I believe in you.
I don't like feeling rushed. So, 4 years. No, okay.
Is that what I did?
Yeah. Good morning, everyone. You have to forgive me. I'm a little slow. One of the reasons I asked to go last is I kept asking Jason and Elizabeth what time I had to be here this morning, and the answer remained the same. They kept saying 8:30, and in my head I was just like, yeah, but I don't do things that early. So I need more time, but the answer didn't change. So I showed up at 8:30 this morning, so I needed a little bit more time to ease into things. Lishaun Francis, Children Now, we are a statewide research, policy, and advocacy organization. And most of my work is in the health space, definitely some crossover with education, because how could it not with children? And I will say that since I've been doing this work, I've been at Children Now 6 years now, but I've been in the advocacy space for 10 plus years at this point. And one of the things that those of us who have gone to policy school and think we're so smart do when we graduate is we think the reason why things aren't working is because you simply haven't thought of it yet. Like, that's obviously what it is. We haven't solved poverty because we haven't thought of the solution to end poverty as yet. We haven't solved systems integration because we haven't figured out the solution to systems integration. And then I quickly realized that that was incorrect. That is a lie. We do have solutions. We know how to solve all of the problems. The reason why it's not happening are for other reasons, most of them political. So how do we get our policymakers to have the political will to solve problems? That's what my work is about, is really pushing policymakers, politicians to solve real problems. And here's one of the ways that I do that. And I will tell it to you with hopes that you will do the same thing and ask the same question. I can't promise that you'll make friends, but we'll go with it anyway. One of the questions I always ask is, who asked for this? Whatever policy it is, whatever intervention it is, who asked for this? They hate when I ask this question, by the way. They absolutely hate. I could see it in their face. One, I rarely get a response. I rarely get a response. One, I ask it because I probably know who asked for it. So here we are. And I would just like you to say it out loud, because who it isn't are children, parents and caregivers, and families. Those are the people who did not ask for it, right? But that would be the right answer. So how do we make sure that if we're truly centering the needs of children and families, that every time you make a call, you send an email, you talk to a policymaker, and you ask them who asked for it, that is their response? Jason talked earlier about the ecosystem paper. We participated in that as well. It's a great paper if you have time to read. How many pages?
32.
32 pages, go for it. But it's not 32 pages. But one of the things that I loved is how much it focused youth voice. Now, this is a paper that was born out of the Children and Youth Behavioral Health Initiative. So we're all thinking this is great. Children Youth Behavioral Health Initiative is asking children and families what it is they need. What would they like to see? And we got some really good responses. Do you know what the problem with that paper is? We started asking those questions after we'd already codified the Children and Youth Behavioral Health Initiative. So what are we doing this for? I've literally asked Elizabeth, why are you wasting my time? Why are we asking people what they want after we've already decided what we're going to do? So really what you have are communities who continuously feel like things are happening to them. They're not part of the solution. You're hosting all of these interviews and talks and focus groups with families to then turn around and say, but what we wrote in the Children and Youth Behavioral Health Initiative is this. But who asked for that? Don't tell me it's a good idea. Who asked for it? It might be a good idea that nobody is asking for. Right? Like those exist. It might be a great idea, but families might not necessarily see that as the solution or see that as something they need. So really my goal is to get folks here to start asking who asked for this. And if the answer isn't families, then we need to start over.
Awesome. Thanks, Lishaun. All right. So we're gonna stay on this topic because I actually think it goes to one of the central points that Lishaun was talking about, which is how we think about policy development, and in particular, how you center children, youth, and families, and the organizations that are serving them directly, like on the ground, how that happens. So I want to turn first, Natasha, to you, and just get us going with, like, what do you think would need to be done in order to, as Lishaun is saying, more centrally focus the voices of children, youth, and families at the beginning of the policy development process?
I think first of all, is this on? Yeah. I think first of all, just piggybacking on what Lishaun said, is really starting with the voices of families, but doing it in a way, like I mentioned before, is really honoring their voice and not taking that for granted, but really starting with parent voice. The other thing is making sure that systems are aligned. Just some examples of systems misalignment is like licensing. Licensing has different requirements than a federal program, so like Head Start, and different requirements than a program like CSPP. And so when you have that, and when you have that siloing, it creates so much more work on the back end for families and for the workforce. And so when we're talking about getting input, also including the workforce in that, because the workforce will tell you that we have to fill out we have to use 5 different data systems to do reporting to the state. We have to, and then a new one just got released actually, or maybe 2 more actually just got released when there were already several. And then there's also other data management systems for other types of funding. And a lot of programs run multi-funding streams, run using multi-funding streams. And so recently there was a situation where we just learned that for CSPP, these are just examples. For CSPP, when you do attendance, only CSPP hours and children should be on a separate sign-in sheet. than the rest of the sign-in sheets, or we have to keep different file folders for different types of programs. So it just really makes it really difficult for families and for the workforce to do some of the work that kind of, it clouds the work that we're able to do, and it takes us more time to do those things than it gives us to really work with children and families. So I think, yeah, that's a huge barrier and issue for us.
Go ahead, Trina. Yeah.
I was going to hand this back to you.
Oh, okay, got it. Well, actually, let me go to Tanya, because I think, as Lishaun was talking, I imagine you might, in some of those circumstances, been on the other side of the table.
Sure.
And I'm just curious, like you've seen folks probably stream through the legislature. What kind of strategies would you put up for this room or for children, youth, and families in terms of coming up to the Capitol, promoting integration?
So two things. One is, I think a lot of people don't understand where this comes from. So my colleagues and I we do a lot of site visits in the fall. We have more time, and I often hear a teacher say, well, my principal is making me do this, and then the principal says, no, the district's making me do this, and the district says CDE's making me do this, and the whole time our colleagues are thinking, we're all thinking, actually, the governor and the legislature is making you do this. So there's a little bit of a civics problem, actually. People need to know. And, it's funny too, sometimes I'll meet my some state agency friends here. So with apologies to them, sometimes I meet with state agency staff and I'll say, I'll ask about information about a problem and they'll present the problem and I'll say, ooh, that's a problem. And they'll say, yeah, but it's the law. And I think, yeah, that's actually why I'm talking to you about it. It's because it's the law, and that's what we do, is we change the law. It didn't come from, the clouds. It came from people. It came from your elected representatives, and that's who we serve. So there's that problem. But the bigger problem, I think, is that we don't have a mechanism for you to share with us the points of friction when you try to work together that you bump into all the time. Licensing, credentialing, data, funding problems, just different definitions for the same thing. All of those are really real to you, but we never get to hear about them. So you're all part of probably statewide associations. They're great. They're in our offices all the time lobbying. But I see Surrett over here from AXA. Surrett, can AXA ask for 97 things from the legislature? No, you ask for 5 things, right? And all of those things that are real, that are impeding your ability to serve kids, we never hear about them. So one of the things that I think would be the most helpful to us is some kind of mechanism for us to hear about the things those points of friction that you're bumping up against, so that we can fix them. I guarantee you there are people who are looking for problems like that to fix. We just need to know about them.
Awesome. Thanks, Tanya. So let me move. I'm going to shift the question a little bit here in terms of thinking about, maybe this is the magic wand question of policy, but if you could promote or put something into policy next year and the years to come that you think would accelerate the ability of everyone in this room, those that are in child serving systems in California, to integrate better, what would you say those things would be? Like what's the number one thing on your wish list that you would want to see? Trina, let's start with you.
I agree with Natasha. I think that it is systems alignment. All of our reporting requirements are different. They can be overwhelming. Our budget reporting is different. It's so different and so overwhelming. If we could align it in some way, that would really be helpful, because right now it's very overwhelming for our staff. And it takes away from youth. It takes away our time that we could be spending on youth.
Yeah, let's give it up. What's on? You don't have anything to say? Okay. Natasha, Tanya, you want to weigh in there?
I also think creating enough flexibility in funding sources so that programs can innovate in what integration looks like, because funding streams have very specific ways of doing certain things and having certain reporting requirements and doing things in a certain way, that it really prevents systems and even programs to talk with each other, to integrate. And so I think it's important to really provide enough flexibility of how programs can use that funding to support deep integration.
So we've got about 5 minutes left, and I just wanted to ask if there were any questions from the audience. We've got a couple. We'll come up here to this table. If you just stand up, use your teacher voice, we'll try to capture it. Awesome. Thank you. All right, so for just those in the back that didn't hear Rachel's question, what she was asking is, how do we create a system in which we're creating accountability for integration is where you were going? Great. Okay. Who wants to go first? Yep. Go ahead, Tanya.
I can try. Another problem that we have, I think, as policy makers and staff to policy makers is we don't have a great system for monitoring implementation, right? So we build in accountability measures into, everybody's familiar with all the, bad things that can happen to you if you don't follow the law, but we don't do a good job of implementing things. And that example I gave of, the teacher saying the district making me do it, half the time we see that and we go, that's not actually what we meant in the first place. So that's a problem. I think the other, well, maybe I should stop there. I think that if we had a better sense of how things were being implemented, we would both get feedback, which would allow us to course correct, to adjust, to fix problems and, friction points that you're experiencing, and it would also probably help our policy development.
Yep.
I would just say really quickly that I think accountability can be pushed by you, by the folks in this room. The reality is your elected officials are going to focus on what you want them to focus on. And we all get very distracted every 2 years, every 4 years about things. And what we tend to do is, listen to what our elected officials are saying, not what they're doing. So what would it look like instead if you showed up and you said, this is what I care about. This bill was implemented 5 years ago. It's not going well. How are you making sure that this is going to work? This is what this community cares about. We care about things that you promised us working well, not the fancy new toy that you're introducing. And that is what needs to happen. But that comes from all of us in this room.
Right. Jason, could I add on to that?
Yeah,
It's not exactly on your point, Rachel, but I feel like, the advocacy comes to us siloed too, right? You all fight for your systems. There is no lobby for integration. Nobody's showing up saying, God, I really wish you could just help us integrate these systems. So that would help a lot. The other thing is that it's still unclear to me, and I think a lot of us, what exactly you would like state policy to say about integration. Do you want it to say you shall collaborate? Do you want it to say you shall jointly plan? Do you want it to say please jointly plan, please collaborate? It's not, that's also not, I think, remains kind of undefined in our minds.
So two points, and then we'll take one other question in the back before we wrap up that I'm hearing from the panel. So the first is about this feedback loop, right? There's a lot that comes from the state down to direct service and implementation, but not a lot that's moving back up to provide that level of feedback, especially when it comes to voices of children, youth, and families. The second, which Tanya, you raised, and I think is an extraordinarily important point. So Senge talks about this in his systems change work, that it's kind of like a fish swimming in water. Like we're all fish swimming in the water, right? So the entire ecosystem is organized around silos. And it's not just the people in the systems. It's the advocacy groups, it's the nonprofit. I mean, you literally keep going all the way down that list, which kind of breaks my brain, but it also allows us to realize the magnitude of the problem and at least maybe a place to start when it comes to that feedback loop. And my next step is to launch this research that I was referencing earlier. We'll probably have a lot more to say about that in the coming years. With that, I want to say thank you so much to our panelists, wonderful dynamic panel. And I saw some other hands shooting up in the room. The panel's probably going to be around after, so feel free to kind of find them out and ask your question. Thanks so much.